Good morning. Today we're going to talk about inflammatory disorders. So, inflammation related to the heart is an extended inflammatory response that often leads to the destruction of healthy tissues. This primarily includes the layers of the heart. The inflammatory disorders related to the cardiovascular system that nurses should be familiar with include pericarditis, myocarditis, rheumatic endocarditis, and ineffective endocarditis. So here's what I just kind of talked about. It's related to any of these that you're familiar with, pericarditis, myocarditis, the endocarditises. So health promotion and disease prevention. Early treatment of streptococcal infections can prevent rheumatic fever. And then prophylactic treatments, including antibiotics for clients who have cardiac defects, can prevent ineffective endocarditis. And influenza and pneumonia immunizations are important for all clients, especially older adults, in order to decrease the incidence of myocarditis. So some risk factors that we see, like in your assessment, anytime that we see congenital heart defects or cardiac abnormalities, we have intravenous substance use is one of the major red flags for this. Heart valve replacement, immunosuppression, rheumatic fever and other infections. They talk about school-age children who have long duration of streptococcus infection. And malnutrition, overcrowded areas, and like a lower social economic status. So some expected findings with these different diseases, and you'll want to know these and like their particulars to each one. So pericarditis, this is the inflammation of the pericardium. It commonly follows a respiratory infection. It can be due to myocardial infarction, so that MI that we've kind of talked briefly about. Looking at findings including like chest pressure, pain, aggravated by like breathing, so mainly like on inspiration they'll have this major chest pain, coughing, swallowing. A pericardial friction rub is auscultated, usually at like the left lower sternal border. They usually present with like shortness of breath and relief of the pain when sitting and like leaning forward, kind of almost in that tripod position. They're kind of bringing that chest forward. So myocarditis, this is the inflammation of the myocardium. This can be due to viral, fungal, or bacterial infections or a systemic inflammatory disease, such as things like maybe like Crohn's disease. Findings with the myocarditis is usually tachycardia, a murmur, usually a friction rub auscultated in the lungs, cardiomegaly, chest pain, and dysrhythmias. The rheumatic endocarditis, this is an infection of the endocardium due to a complication of the rheumatic fever. This is usually preceded by group A beta hemolytic streptococcal pharyngitis. It produces lesions in the heart, and the findings usually include like fever, chest pain, joint pain, tachycardia, shortness of breath, rash on the trunk and extremities, so like on your midsection and extremities. Usually heard of friction rub. They have a murmur and they have muscle spasms. So ineffective endocarditis, this is an infection of the endocardium due to a streptococci, a fungi, or other infectious organisms. I think I might have said, so I want to repeat this. I think I might have said one of these wrong. So the endocardium, it's an infection of the endocardium due to a staphylococci, a streptococci, fungi, or other infectious organisms. This is most common in clients who have structural cardiac malformations like cardiac devices such as pacemakers, prosthetic heart valves, or IV substance use disorder. Invasive procedures such as dental procedures, body piercings, tattooing can cause bacterium, and which can lead to infectious endocarditis in at-risk clients. So we kind of talked about that a little bit with like dental procedures with valve replacements, that they always want to make sure that they're taking like antibiotics because they are so susceptible to those and at risk for those infections. Findings of the ineffective endocarditis is fever, flu-like manifestations, murmur, petechiae on the trunk and mucous membranes, positive blood cultures, and sphincter hemorrhages, so like red streaks under the nail beds. Laboratory tests, blood cultures to detect any bacterial infection. An elevated white blood cell count can be indicative of a bacterial infection. Cardiac enzymes can be elevated with pericarditis. Elevated ESR and CRP indicate inflammation in the body. And then there are throat cultures to detect any streptococcal infections, which can lead to the rheumatic fever. Diagnostic procedures. Here we're going to see some of these same things that we've been talking about a little bit. So we have the electrocardiograph, that's that ECG. It can detect a heart block, which is associated with rheumatic fever, or demonstrate ST segment elevation in almost all leads in the case of pericarditis. The echocardiograph can reveal inflamed heart layers or the pericardial effusion. So that's what they kind of look at with those two procedures. So what are you going to do? You're going to auscultate those heart sounds, listen for murmurs or any type of friction rubs. You're going to review those ABGs, the SaO2 and chest x-ray results. You're going to administer oxygen as prescribed. Monitor those vital signs. You're going to watch for a fever specifically. Monitor those ECGs. Monitor for cardiac tamponade and heart failure. You want to be able to obtain throat cultures so we can be treated by antibiotic therapy. We want to administer those antibiotics as prescribed. You want to also administer any pain medicine, encourage a lot of bed rest, and provide emotional support to the client's family and encourage any type of verbalization of feelings. So the medications you're going to see with these, your penicillin, this is the antibiotic given to treat the infection. Remember, we want to monitor for any skin rashes or hives when we give this medicine, and monitor for electrolyte and kidney levels. Client education, you want to make sure you instruct the client to report skin rashes or hives and inform the client that the medication can cause like a GI distress. Ibuprofen, your NSAIDs are given to treat the fever and inflammation. Remember some nursing considerations: do not use with clients who have like a peptic ulcer disease. We want to watch for any indications of GI distress. And you want to make sure we're monitoring your platelets and liver and kidney function levels. Client education, instruct the client to take the medication with food, what to watch for with GI distress, and to avoid alcohol consumption while taking the ibuprofen. Prednisone, we've talked about this a lot, but this is given to treat the inflammation. Just make sure that you are monitoring your electrolytes, the blood sugar levels, blood pressure, and clients can have impaired wound healing with taking, this medicine. You want to make sure you're instructing the client to take this medication with food, to avoid stopping the medication abruptly, and to report any unexpected weight gain. Then we have the amphotericin B. This is an antifungal given to treat fungal infection. Nursing considerations, we want to make sure that we're monitoring liver and kidney function levels. And for client education, inform the clients that the medication can, again, cause GI distress. So therapeutic procedures. With pericarditis, there is a cardiocentesis, is the insertion of a needle into the pericardium to aspirate that pericardial fluid. This can be done in the emergency department or in a procedure room. So nursing considerations and actions, a pericardial fluid can be sent to the laboratory for culture and sensitivity, and we want to monitor for reoccurrence of any cardiac tamponade. Ineffective endocarditis, there's a valve debridement, draining of any abscesses, and repairing congenital shunts or procedures involved with ineffective endocarditis. Nursing actions, we want to monitor for indications of bleeding, infection, and any alteration in cardiac output. So client education, what are you going to educate them on? We want to encourage the client to take rest periods as needed, wash their hands to prevent infection, avoid crowded areas to reduce any exposure to infection, and we want to make sure that they are doing good oral hygiene and the prevention of any infection that way. We want the importance of talking to them about their medications and taking it as prescribed. We want to talk about smoking cessation if we need to. We want to make sure that the family is educated on, illnesses and risk of infection. And then we want to advise all providers, including dentists, of the history of the endocarditis so that antibiotic prophylaxis is prescribed if needed. Last thing we're going to talk about is the cardiac tamponade. So what we talked about here is cardiac tamponade can result from fluid accumulation in the pericardial sac. So a lot of times manifestations include like dyspnea, dizziness. They report of like tightness in the chest. A lot of times they have increased restlessness, tachycardia, muffled heart sounds, all of those things. We look at the hemodynamic monitoring, reveals intracardiac and pulmonary artery pressure similar and elevated. So they have what's called like a plateau pressure. What you need to do as nurses, we need to notify the provider immediately. We need to administer IV fluids to combat that hypotension. We want to obtain a chest x-ray or endocardiogram to confirm the diagnosis. And we also want to prepare the client for a periocarditis, which again, I don't think I talked about this earlier, but we need to make sure we have an informed consent, all of that when we're doing any procedure like that, because there's risk of different things. So we want to make sure that we have an informed consent. We want to be gathering materials, administering medications as prescribed. All of them, we need to make sure we're monitoring those hemodynamic pressures, the heart rhythm, monitor for reoccurrence of the manifestations after the procedure. So we will talk more about this. I plan on doing a review. I wanted to get this in front of you guys a little bit. I want you to kind of dig in a little bit, and then we'll probably talk about it more when I'm back in the office. So let me know if you have any questions. Have a great day.